Church Health Center Wellness and the Church Health Center and all that we offer here at our wellness facility?
Okay, our wellness facility really covers a whole spectrum of programming. We see everyone from people who are just coming out of cardiovascular surgery to those who are running a marathon for the first time. And so we cover all aspects of health and performance, just offer people the opportunity to improve their health wherever they are.
Very nice. So this is a facility, is this the only facility like with the weights and the basketball court? Are there other to go along with it?
There's only one Church Health Center in the world. There's lots of other organizations who are interested in duplicating our line of services, but there is only one Church Health Center.
Gotcha.
Yeah, and we talk about how we encourage the faith community to kind of come in here and build healing ministries kind of in their own congregations.
Okay, sure. Oh yeah. We have an outreach program through Faith Community Outreach, and its goal is to take the services of the Church Health Center and incorporate them into local ministries within the church. And so it may not look like our facility, basketball and programming and weight loss, but they do things like encouraging people to reconsider having their blood pressure checked on a regular basis. We're looking at ways to lower the incidence of diabetes in their congregation. Starting walking programs in the neighborhoods, anything they can do to improve the overall health of their congregation.
So you teach the person how to on their own time?
Yes, they come in, they volunteer, they go through a training program. I believe it lasts about 2 months, and we equip the individual to locate the resources in the community to actually bring those services to their location.
Talk about how we just got certified as a Memphis or a medical fitness facility.
There's a certification through the Medical Fitness Association, which is it has about, I believe it's about 1 million members, and they all represent facilities that are making efforts to help in the transitional care component. So people who are coming out of a traditional medical establishment and want to start exercising on some scale. MFA deals specifically with, or MFA is interested specifically in those kinds of organizations. We recently received a certification from them, which basically says that we are doing a great job of providing those services to the community.
Wonderful. Say just a little bit about how the Church Health Center medical side has like a work requirement and yada yada, but how wellness is open to the entire community.
Okay, sure. We offer primary care medical services for anyone in the community. We target primarily those who are working but uninsured. We're able to access our clinic services at any point in time. They pay, how much they pay?
It's based on a sliding scale.
That's right, a sliding scale. Services are based on a sliding scale. They're able to pay as minimum of as little as $3 up to $30 to $40 per visit.
And then talk about wellness.
The wellness facility is open to the public. Anyone can come here. We have all kinds of people to walk in the facility. Anyone in the public is welcome to come in and use our services. There's a sliding scale for those who are eligible. They can pay anywhere from as little as $15 a month up to $62 a month for a family membership.
And what is the limit on the family member? Is it 4 or more, 4 to 6, or?
It's a good question.
I think I just saw it, and I think it's any 2 adults and the children that they support. So it could be grandparents, it could be 6.
Yeah.
We have large families that do come in.
So,
but it's any 2 adults and the children that they support.
And just kind of talk a little bit about all the services that you might find at wellness, cooking classes, child life.
Sure. We offer a wide variety of services in our wellness facility. Everything from cooking classes for adults as well as for children. We have smoking cessation classes. We have a diabetes education program. We have a weight maintenance and weight loss program. We offer stress management classes, ballet classes, yoga classes, Pilates, additional group exercise classes such as group cycling, step aerobics. We have a therapeutic pool that we use to help people transition into more aggressive exercise programs. We offer seasonal sports such as basketball, volleyball, and soccer.
Volleyball? Is that?
It really is a sport.
Explain volleyball.
Yeah, please do.
It's great.
Volleyball is a hybrid sport using a racquetball court and something that looks like a very large racquetball, a volleyball-sized racquetball. You have 6 people on a side and a in a racquetball court. And they basically hit the ball back and forth, and you have 3 hits just like in traditional volleyball, and it can't touch the floor.
That's interesting.
It's like volleyball and racquetball. There's a net.
Steroids. I mean, it's just
Is that like basketball?
it's like that. It's
Yeah.
very fast and
Totally.
crazy.
Totally.
There's a really large following for it. We probably have about 20 people when they're playing. They play 3 times a week, and there's about 20 people that show up every time.
And they have competitive teams. Is it 2 per on a team?
6 people on a side.
On a side, okay.
12, anywhere from 10 to 12
So you
people
have
in that
about
little room.
And then people
2
sub
teams.
out.
They do.
Yeah, I've seen it. It's great.
So
I've played
is it
it.
fast-paced like hockey?
It
I
is.
guess.
Yeah.
That
It's
is
more like,
interesting. You know what I notice is that you guys offer a lot of things that traditional sports facilities they don't offer, like the racquetball and what have you. They only offer the weights and the treadmills or the bikes or.
So unlike most traditional exercise facilities, our goal is to help people where they are, to identify their health status, and then to progress them. We have staff, all of our staff have degrees in exercise science or related field, and they serve every day to help people progress. We have a diabetes follow-up program as well as an obesity follow-up program where any member within our facility can access the staff appointments once a day or once a week, and they're there simply to help them progress. So we design the exercise programs, contact the physicians, make sure that everything is going according to the medical plan.
And before they start the wellness program, say that they are an obese person or a diabetic person, do they need to see their physician before to get approved before coming to you?
We actually do a risk assessment here.
Okay.
Someone comes in, we look at their medical history, and we determine if there are any issues that might need to be addressed by their physician before they start an exercise program. But we give them all the referral information they need to bring that back to us.
And they can come right here to the medical offices down on Peabody to get that service.
We have a large number of members who are clinic patients. And so we're able to contact their physician immediately and get information that we need directly from the medical chart.
Very nice. What about the children's programs? How old do they need to be in this area of the facility?
Our Child Life and Education and Movement, the long name, they actually have their own staff. Their services are the exact same as the adult services that we offer. So if we have a cooking class for adults, we have cooking class for children. They also have exercise programming. You can see over, they've got exercise equipment. Went over.
Oh,
yeah.
Hydraulic equipment for little kids.
I will definitely go over there and check that out.
And so it is programming for our children is handled by their own separate staff. They've got exercise. They've got group exercise classes that they attend. In order for any child to be a part of a membership, they have to be at least 6 months old. Up to the age of 12, they're actually within the Child Life department. From the age of 12 up until the age of 16, they actually can exercise independently on the floor with adult supervision.
And is that an extra cost, the children's program, or is that part of the family
It's a part of the
membership?
family membership.
Very nice. I'm trying to think.
He pretty much covered most of
He
it.
did.
Yeah,
He
the big
did.
stuff.
Do you provide towels or a locker and locker facilities, just like locker room? You know?
We do have locker facilities available. Lockers are available on a daily basis. We
Like
should
a
ask our
first come,
members.
first serve kind of
Yeah,
thing.
first come, first serve. We don't offer towels. We do offer equipment cleaning supplies for the members to come in and use.
That's perfect.
Wonderful,
Is that
Richard. Yeah, I think that's it.
That's
All
it.
right.
Thank
Unless you got
you.
any
You're
other
welcome.
questions.
Right here in Memphis, Tennessee, we're going to host January 15th, myself, Tracy Knight, and the Everything Wellness Show from KWAM 990 will be right here in the parking lot to bring you the best of all the wellness information that you need to kickstart your 2011 year. We're excited to bring you this wellness campaign right here at the Church Health Center, located at 1115 Union Avenue. Come check us out, Everything Wellness Show on Facebook, or listen to us 11 a.m. Saturdays at KWAM 990 on the internet, www.kwam990am.com. We're also going to be streaming live, ustream.tv. Go to Everything Wellness Show page and see us on KWAM 990's homepage. This is Tracy Knight with Everything Wellness Show at the Church Health Center, located at 1115 Union Avenue, right here in Memphis, Tennessee.